Hello, my name's Dr. Whitney Graff, and I'm here to present a case of primary Ewing sarcoma of the clavicle. I'd like to thank both Dr. Whitney Fuqua and Dr. Lauren Tollefson for their help and preparation of this presentation. Our patient is a 23-year-old male who presents with a painless soft tissue mass noted over his left clavicle. He states that he noticed this approximately 2 months prior. Initial x-rays of the left clavicle were taken, which I've included here. The initial x-rays were reported negative. However, if we zoom in on the diaphyseal portion, we can see that there is questionable cortical disruption of that superior margin. Approximately 1 year later, the patient presented back for care and states that now the mass has become painful and also increased in size. Now we can see both the superior and inferior margins demonstrate cortical loss with a permeative to moth-eaten pattern of destruction. CT, MRI, and PET-CT were all performed as follow-up imaging. Here is the axial CT, and if we zoom in over that left clavicle, we can see the soft tissue mass noted both anteriorly and posteriorly to the clavicle, demonstrating a similar attenuation to that of skeletal muscle. Here is the T1 fat suppression and stir sequences of the MRI, which demonstrates increased signal intensity both within the clavicle and of the adjacent soft tissue mass. The PET-CT demonstrated evidence of metastatic disease of both the right ilium and the right scapula with the associated increase in uptake. The mass was then biopsied and diagnosed as Ewing sarcoma. We can see crushed small round blue cells on the histology slide, which were noted both within the patient's left clavicle and of the soft tissue mass. Some quick facts about Ewing sarcoma. It's the fourth most common osseous tumor, and the translocation is on chromosome 22. It's part of the Ewing sarcoma family of tumors, which comprises 5 lesions and is pathologically classified as a neuroectodermal tumor. 90% of patients are between the ages of 5 and 30 years old, with the lower long bone, sacrum, and innominate bones being the most common location. It is most often located in the diaphyseal portion of the bone. 60% of patients report a soft tissue mass or adjacent swelling, which was noted in our case. If we go through the differential diagnosis, if you're looking at the radiologic appearance alone of a permeative pattern of osseous destruction with an adjacent soft tissue mass, you should also consider an osteosarcoma, a chondrosarcoma, and a plasmacytoma, especially in older patients. If you look at clavicular lesions separately, primary tumors here are rare and comprise less than 1% of the lesions. Myeloma and osteosarcoma are the most common malignant lesions here. However, interestingly, in a study done by Kapoor, Tewari, and Kapoor, they actually found that Ewing sarcoma was the most common primary malignant clavicular lesion. The acromial end is most commonly involved, with the diaphyseal portion rarely involved, which is also a unique aspect of this case. Unfortunately, a delay in diagnosis for Ewing sarcoma occurs frequently, with the average time span being 3.7 to 6.3 months. In our case, that delay was approximately 7 months after the patient's initial presentation. 21% of patients have metastatic disease at presentation, with the lung and bone being the most common locations. A study done by Bacci et al. Found that the time to diagnosis did not actually correlate with the stage of disease. However, patients with metastatic disease are often diagnosed earlier than those with localized disease alone. Other factors associated with decreased survival rates include a tumor volume greater than 150 milliliters and a poor histological response to chemotherapy. The management of malignant lesions of the clavicle often involves end block resection, which has been found to have good tumor control, but still has a less favorable outcome if the patient has metastatic disease. Ewing sarcoma specifically is more sensitive to chemotherapy and radiation, which were the only 2 treatments used in our case. Unfortunately for our patient, the tumor recurred 2 years later, and he has passed away due to related complications. Thank you for your time.